This diagram indicates the radiation treatment process and the number of days needed for each step. Once you have been referred to our center, a radiation oncologist reviews your case and decides if radiation is a good treatment option for you. Referral to consultation appointment may take from 1 to 14 days. If radiation treatment is recommended, then a consultation appointment is arranged. At this appointment, you, your family, and your radiation oncologist will decide on your best treatment option. Your simulation appointment is then scheduled within 2 to 5 days. Your actual simulation appointment will happen on one day. Careful, detailed treatment planning is then completed, taking 1 to 10 days. Finally, radiation treatments are given daily for 1 to 39 days. The actual number of treatment days depends upon your particular healthcare needs and your recommended treatment plan. As a patient, you must be present for the consultation, simulation, and radiation treatment steps. You will not be present for the referral, scheduling, and planning steps. A simulation is carried out to gather information required to plan your radiation treatment. The simulator, a CT scanner, is used to capture information specific to your body, the tumor's location, and surrounding normal tissue. Your simulation appointment should take no more than 30 minutes. On the day of your scheduled simulation, a radiation therapist will escort you to an interview room. The therapist will explain what will occur during your simulation appointment. They will also take an identification photograph. This will be added to your radiation therapy chart. Information pamphlets for specific areas of the body have been created for you by the staff of our cancer center. At your simulation appointment, you will be given the appropriate pamphlet for the area of your body being treated. Each pamphlet explains potential reactions that may occur during the treatment period and suggests ways to self-manage these side effects. However, please be aware that side effects are difficult to predict, as they depend on the treatment site, the amount of radiation given, and other medications used during treatment. The information pamphlet will also explain what to expect on the first day of treatment and any special preparation you may need to do. Please read the pamphlet before your first treatment session. If you have any questions, ask your radiation therapist at this appointment. Prior to your simulation, you will be shown to a change room. You will be asked to change into the gown provided. There are lockers available where you may leave your clothing and valuables. Once changed, return to the interview room to wait for your therapist. The radiation therapist will return to take you to the simulation suite. In the suite, you will be asked to lie down on the couch where you will be placed in your treatment position. A positioning device may be used to help you maintain this position. The type of device used is determined by the area of your body being treated. For example, if your upper chest is to be treated, a positioning device may be used to place one or both of your arms above your head. If treatment is to be given to the head area, a personalized mask is created. This thermoplastic mask is placed in warm water to make it flexible. It is then formed over your face. The mask is an open mesh and you can breathe normally when it is in place. It allows us to precisely reproduce the position of your head for treatment on a daily basis. It is very important that you are in the same position for your simulation as you will be during radiation treatment. Once satisfied that you are positioned correctly, the therapist will place marks on your skin. Small beads will then be placed on these marks. These are visible on the completed CT scan. The couch you are resting upon will then move you into the scanner. Your therapists proceed to the control room to conduct the scan. You will be visible to them at all times through the viewing window. The scan is taken very quickly, in only 10 to 30 seconds. Therefore, it should be fairly easy for you to remain still while it is completed. There is usually no need to hold your breath. just relax and breathe normally. It is important to remain still, as any movement may blur the scan and it would have to be repeated. The radiation therapists will come back into the room once the scan has been completed. They will then place tattoos at the location of each of the marks on your skin. The tattoo is a dot of sterile ink placed under the top layer of skin with a sterile needle. They will not wash off when you bathe or shower. The tattoos are important as they are used to accurately position you for each radiation treatment session. You may not see your radiation oncologist at this simulation appointment. However, if needed, your oncologist will be sure to speak with you before you leave. You may now change back into your clothes. Please check in at the reception desk before you leave the center to pick up your appointment letter. This letter has the date and time of your first radiation treatment appointment. Prior to your first radiation treatment, considerable effort is required to create a high-quality treatment plan that is specific to you. The dosimetrist creates your personalized radiation treatment plan. They use the information gathered from your simulation and any additional information provided by your radiation oncologist. The tumor and treatment area will be carefully outlined or contoured, as will your normal, healthy tissue. Contouring is basically outlining areas of interest within the CT scan data. Exact angles and dosage of radiation will then be carefully calculated and documented in your personal treatment plan. The objective is to optimally focus the radiation on the tumor and affected area, while minimizing irradiation of your normal, healthy tissue. After your treatment plan has been completed, it must be approved by your radiation oncologist and checked by both a medical physicist and your treatment therapist. The duration of treatment is dependent on your unique needs and may vary from 1 to 39 days of daily radiation treatments. Refer to the letter you received during your simulation for your first treatment appointment date and time. On your first day, please arrive at the cancer center approximately 20 minutes early for your scheduled treatment time. For this appointment, please check in with the unit clerk at the reception desk. On following visits, please check in directly at the automated patient check-in kiosk. When using the kiosk, place the barcode on the card you received during your consultation under the scanner. This will identify you to the system. The screen will display your next 2 appointment times. It is very important to check these displayed times against your appointment letter. The time on the screen will always be your correct time. The appointment schedule is often adjusted due to the large volume of patients being treated on a daily basis. Read all the information displayed on the screen as there may be additional instructions for you. If you need assistance, the clerk at the reception desk can help you. After you have checked in, please be seated in the reception area and wait until you are called for your treatment session. A radiation therapist will take you to the change room area. On your first day, the therapist will explain what will happen during your treatment. They will review possible side effects with you, referring to the pamphlet you received at your simulation appointment. If you have prepared any questions concerning your treatment, this is a good time to ask them. When you are ready, the radiation therapist will ask you to change into a gown. You may safely leave all of your clothes and valuables in an available locker. You will then be taken into the treatment suite. Upon entering the treatment suite, you will be asked to confirm your identity by providing your birth date. This is to ensure that your treatment information is displayed in the treatment room. The therapist will help you into the exact position you were in for your simulation appointment. They will use the appropriate positioning devices as required for your particular treatment site. The couch will be raised, and the radiation therapist will align the machine and take measurements. Your position will be checked against your treatment plan and tattoos. The machine will move as part of the setup, but it will not touch you. Once satisfied that you are correctly positioned and the machine is aligned, the radiation therapist will proceed to the control room. You will be alone in the treatment room, but the therapist can see you via television monitors and can speak with you at any time via an intercom system. It is important to remain still during the delivery of your radiation treatment. Continue to breathe normally. You will not see or feel anything from the radiation. On the first day, your radiation therapist may step back into the treatment room to check on your position and to ensure that you are comfortable. By the third day, treatment setup may be done from outside of the treatment room, thus shortening the time you need to spend on the treatment couch. Your treatment time will depend on the area of your body being treated and the type of cancer involved. In general, treatment setup and delivery times are from 10 to 30 minutes per daily session. As previously mentioned, the overall duration of treatment is dependent on your unique needs and may vary from 1 to 39 days of daily radiation treatments. During the course of treatment, various side effects may be experienced. Therefore, it is important for us to continually review your status. Your radiation therapist will speak with you during each session to see if you are experiencing any side effects. Once a week, you will meet with your radiation oncologist and primary nurse to review and monitor your progress. Once you have completed your radiation treatments, your radiation therapist will explain what side effects you may normally experience. Side effects may occur up to 6 months or longer after you have completed treatment. A follow-up appointment with your radiation oncologist will be booked. He or she will further monitor your progress and any side effects that you may have. Your primary care nurse will provide you with a phone number to contact if you experience severe side effects and require medical assistance. If you do require urgent assistance, it is recommended that you go directly to emergency at your local hospital. We also suggest that you arrange an appointment with your family physician and/or surgeon for additional care. We hope we have made you feel more comfortable about coming to our cancer center for your radiation therapy treatments. Our caring team is a group of dedicated professionals who are committed to providing health care to the highest standard. If you have any questions concerning radiation therapy or your specific treatment plan, please do not hesitate to contact one of your care providers here at the R.S. McLaughlin Durham Regional Cancer Center.